नमस्कार, आप सबका स्वागत है हमारे आज के इस लाइव इंटरेक्टिव सेशन में। A very warm welcome to all of you in today's live interactive session. And as always, we shall be taking your questions as well as I shall be taking a very important topic with you today. The topic which I shall be discussing with you today is a topic for which so many patients of mine have consistently been requesting from me that they need to have certain details on that topic. And the topic is ulcerative colitis. I shall be taking all your questions. Please carry on writing down your questions. And to begin with, I shall be starting with ulcerative colitis with all of you. The details of ulcerative colitis shall be given to all of you. So when I talk about ulcerative colitis, as is evident from the name of the disease, it is a disease in which there are ulcerations in the colon. When we talk about colon, we mean to say about the large intestine of our body. Generally, there have been so much of discussion even from my end and from so many doctors about the duodenum, duodenitis. But colon, which is an equally important part of our intestine, is often ignored, and it is over in the colon that ulcerative colitis as a disease can develop. Now, whenever any disease develops inside the body, there are certain obvious reasons for the development of that disease. Here, in case of ulcerative colitis, as far as the allopathic aspect is concerned, there is no clear-cut reason that has been given for the development of ulcerative colitis. But yes, there is a theory, and today the allopathic world, it believes that ulcerative colitis can be due to the attack of one's own immune system on the colon, due to which there is an inflammation and ulcerations that develop in the colon. And when we talk about the colon, जब बात मैं हमारी लार्ज इंटेस्टाइन की कर रहा हूं, तो वहां होने वाली अल्सरेशंस में जो डिजीज हो जाता है उसे अल्सरेटिव कोलाइटिस बोलते हैं. सो कमिंग टू द टाइप्स ऑफ अल्सरेटिव कोलाइटिस, when we talk about ulcerative colitis, depending upon the degree and depending upon the grade, the site of ulceration, ulcerative colitis has been divided into various kind of types. I'll see if I can show you the types of ulcerative colitis over here, but prior to that, I will like to show you a healthy intestine. As you can see on your screen, this is the healthy intestine which is there inside an individual's body. You can see the ascending colon, the transverse colon, the descending colon, sigmoid colon and rectum in a normal intestine. There is no inflammation in this intestine, as you can see over here. And then when we talk about ulcerative colitis intestine, you can see the reddishness. The red color indicates the inflammation which can be throughout the intestine or which can be partially in the intestine. So it depending upon the site of the inflammation, the ulcerative colitis can be of various kinds. I would like to show you the various types of ulcerative colitis, and as you can see on your screen, ulcerative proctitis, this is the simplest form of ulcerative colitis. This is the mildest form, and in this mildest form, it is the rectum and the lower part of rectum around the anus which is basically inflamed. The rest of the colon is all right in it. So this is the simplest one. There are not much signs apart from a bit of discomfort. There is not too much of problem in this case. Then comes the second one, proctosigmoiditis. Now, when we talk about this stage, it is the rectum as well as the sigmoid colon. When I talk about sigmoid colon, I will once again like to show you the sigmoid colon, so that you can understand what exactly I am talking about. So you can see the sigmoid colon over here. The sigmoid colon is the part just before the rectum. You can see it over here as it is visible in the picture. So when this sigmoid colon is also involved along with the rectum, it is proctosigmoiditis. So when these two parts are involved, now pain and bloody diarrhea starts. This is the first type of ulcerative colitis where the patient complains to the doctor that it's not just pain, but pain as well as bloody diarrhea. Blood comes in the stool and there is always a urge to go and pass the motion. But still, after passing the motion also, a person feel that despite that there is not proper evacuation in this case. So we are talking about various kinds of ulcerative colitis today, and it is an important topic. That is why I am taking this topic with you. So the next type of ulcerative colitis is left-sided colitis. As is visible from the name also, it is the rectum which is involved, sigmoid colon that is involved, and with sigmoid colon it is the descending colon also which is involved over here. I would like to show you the descending colon. You can see that from the rectum it is the sigmoid colon. From the sigmoid colon, the next part, descending colon, is also involved over here in this condition, and that is why it is more advanced stage to the proctosigmoiditis or the ulcerative proctitis. So in this part, when more part of the intestine is involved now, bloody diarrhea becomes more evident. Then there always remains a pain on the left side. Along with this, a person may start experiencing weight loss over here. Now this is an advanced stage, a real advanced one, and after this comes the pancolitis. Now pancolitis is the most advanced one, and in that the entire colon, when I talk about the entire colon over here, you can see again in the picture the rectum, the sigmoid colon, the descending colon, the transverse colon, the ascending colon. The entire colon over here is involved in this disease. So when entire colon is involved, so there will be pain, bloody diarrhea, fatigue, and significant weight loss also occurs in this condition to a patient. Apart from these types, there is a separate type which is severe acute ulcerative colitis. This is a rare type of ulcerative colitis, and in this rare type of ulcerative colitis, there is severe pain, diarrhea, bleeding, and an added symptom over here is fever. A person suffering from severe acute ulcerative colitis may not be able to eat even. So it is a major disease. It is a disease which causes so much of problem to so many people. So it is really a disease which requires utmost attention from our end. And now when we have talked and we have come to know about this disease, that what exactly this disease is about, I would also like to share the Ayurvedic aspect over here. So over here, when we are to give treatment for a patient suffering from ulcerative colitis, it is the pitta dosha which is vitiated. When we talk about Ayurveda, Ayurveda will pitta and kapha, and it is the pitta aggravation which is the basic cause of ulcerative colitis. But it's not just the pitta. Again, when we talk about Ayurveda, Ayurveda believes in 5 types of Vayu, and Apan Vayu is the Vayu which is the Vayu in Gudha Pradesh. So basically it is the Apan Vayu and Pitta dosha which, when they are vitiated, they cause a disease known as ulcerative colitis. And when we are talking about the treatment of ulcerative colitis in Ayurveda is being mentioned very nicely. See, when we talk about Grahini, in Grahini we get many kinds of Grahini like Sangrahini, Ghati Yantra Grahini. There are various kinds of Grahinis mentioned in the ancient Ayurvedic texts. And It is this Sangrahini and Ghati Yantra Grahini. When we talk about these diseases, it is this disease which in advanced stages can cause or can be compared to ulcerative colitis, and we require a Pitta Shamak Varanashanam. Now why we require a Varanashan Chikitsa over here? Because we really want to, it is like Bilv, Jatifal. Bilv and Jatifal are basically Grahi, and the third Grahi Aushadhi, a good one, is Parna Yavani. Again it is very good over here. And Stamban Aushadhis like Kutaj. So a lot many things technically, if done in a patient suffering from ulcerative colitis, the results are really awesome. And the best part is that the patient starts recovering and visualizing the signs of recovery right in the very first month itself. And what is important over here in ulcerative colitis is Takra. Ayurveda believes that Takra should be used in a patient who is suffering from ulcerative colitis. So that was my topic for you today, ulcerative colitis, which I wanted all of you to understand. Thanks for going with me, carrying on with me for this topic. मैं आशा करता हूँ कि दी गई जानकारी ने आपको लाभ जरूर पहुंचाया होगा, और इसी उम्मीद के साथ कि आप सभी लोग स्वस्थ रहें, हृष्ट पुष्ट रहें, मैं आप सबसे आज्ञा लेना चाहूँगा। हमारे साथ जुड़ने के लिए बहुत बहुत धन्यवाद।